the fastness.
Hi, I'm Dr. Kristen Jacobs from Ooh La La Spa, Anti-Aging and Wellness in Glen Carbon, Illinois. I am getting ready to have a secret RF treatment. So I have both my nurses in here right now. My nurse practitioner, Carly.
Hi.
And Nurse Jill. I don't know if you can see her too. There she is. And I am as numb as anything, so I don't know if my lips are even moving right now. So that is a good thing. So I'm going to lean back. We're going to all just kind of talk about the procedure as we go. So are you ready?
Yeah,
okay.
we're ready. We're going to start on your neck.
Okay. Jill, if you don't mind, Jill, just talking about what Secret RF is.
Secret RF is great.
Okay.
The awesome thing about this treatment is it really does treat everything across the board. It's going to help with tone, texture, fine lines, wrinkles, and also give her some tightening. We like to do this one in a series of 3 treatments, so we do those 4 weeks apart. And for somebody, it also is great for scarring too. So if we're treating somebody that has acne scarring or also has more sagging or very coarse lines or wrinkles, we may recommend a series of 6 instead of a series of 3. And then after completing the package, it's great to go on a maintenance schedule where we do them quarterly. What Carly's doing right now with each pulse, there are needles going underneath the surface of the skin, and it's also combined with radio frequency heat. So right now she's at the deepest level that she'll go on Dr. Jacobs' neck, and then we'll do, she's actually going to do 3 depths. So she's the deepest now, which is going to give her the tightening because building that collagen deeper is increasing basically the denseness of the mattress to help tighten the tissue. And then as she gets more superficial, we'll be treating tone, texture, and fine lines and wrinkles. This treatment, each time we do full face and neck, so you get improvement all across the board, which is great as well. We give you your post-care products, which you'll use a post-care growth factor and a restorative ointment to help heal the skin quickly and increase that collagen production. And we like to combine this treatment with a couple other treatments that we offer here in the clinic. So it works really, really good to combine it with oil therapy. Oil therapy is a skin tightening procedure, so that boosts the tightening, and you do both of them at the same visit, and then a month later do the Secret RF. What else do we like to combine it with, Carly?
And we're doing it backwards for me this time. We're going to do Oil Therapy Secret in a month, just because we didn't have enough time on the schedule today to do both. So we'll do my second treatment of Secret RF next time with the Oil Therapy.
With
That's what I mean.
therapy.
Yeah.
Some people do lasers also prior
you
to.
can combine it with, if we're treating a lot of things,
That's
we'll
it.
combine it with limelight.
Least it tickles.
Limelight treats hyperpigmentation, so when you combine the two together, limelight's pulling the dark spots to the surface, and then Secret RF is doing the treatment underneath. Then those top layers that have brought the pigment to the surface will flake off. So it's great combined with limelight to help brighten the complexion, which everybody's looking for right now because this is the time of year where we're seeing the most sun damage always at the end of summer. So it's time to treat the pigment and get your skin back in check.
And PRP, because you could also do PRP with this. I didn't even think about it for today. But you could do that too, and that's going to help to stimulate the collagen even more. And it really, I can feel it, but it really doesn't feel that bad. When she gets down by my collarbone, just now, and I jerked just a little bit, it feels like there's a little bit of nerve it's hitting. Or even my muscle spasming or something, but it almost tickles around the collarbone, which I know that sounds ridiculous. And I don't think I got my topical all the way down to that. So it's a little bit more sensitive, but really not that much. So I've had topical on for probably 45 minutes now. So I could still feel it through the topical, because you have to think about the topical is going on the skin surface, and this is going deeper, but it's not bad. On a scale of 1 to 10, it's probably a 2.
Okay.
And that's pretty good for me because I'm a baby. So, so like you said, we can do face and neck. So you can get eye lift out of this. help the under eye wrinkles and texture.
And it's great for stretch marks too, so other areas of the body, you can do this treatment.
Yes, and you know what I want to do is I want to do my upper knees with it.
Oh.
You know, because you know how you get the little, well, you probably don't. You guys are too young.
Texture.
Yeah.
Help the texture and tightening a little bit.
Right.
So you can see the redness. So Carly's done the neck area. So you kind of see this line of demarcation here where she stopped, and the redness on the neck there is basically what you'll see post-treatment. So downtime is very minimal because this redness will mostly be gone tomorrow. The little bit that'll be left tomorrow, she'll easily be able to cover up with our Color Science mineral sunscreen.
So let's talk about the post-procedure care that we do, including your Color Science.
So we do a duo kit for post-procedure. One of the products in that duo kit is a post-procedure repair complex. That's a growth factor serum. So following this treatment, Dr. Jacobs will use that for 2 weeks. And after your series of 3 each time, you'll use it for 2 weeks. And then she'll also use the restorative ointment, which helps restore that moisture level back into the skin and helps it heal quickly as well. And for sunscreen, so starting tomorrow, she can use her Color Science sunscreen, which has a little bit of pigment to it and also will help with coverage and protect her from the sun. She'll have a couple different options, and the nice thing is we can pick a sunscreen that's the consistency that you like, because Color Science offers so many different options. We've got powder sunscreen, we've got Total Protection Face Shield is a little bit lighter, but it's very moisturizing. And then 2 of our other options are All Calm and Even Up, and the awesome thing about those sunscreens is they also have treatment properties. So the All Calm will help treat the redness as well. And if you're somebody who struggles with sunspots, then we would put you on Even Up. So you're going to get your protection, some coverage from the color that's in it, and then also help treat those brown spots while you're healing.
And then, of course, at some point I'll add back in my TNSA Plus, which will help tighten up the skin even more. Which is our growth factors too, and that's our newest version of the TNS, which is outstanding.
And so the Advanced Serum is our newest, like she was just saying. The awesome thing about this one is you actually could use that even the day after.
That's what I'm thinking.
Use both growth factors. Soraya and I were just talking about that.
Oh, good. Okay.
Today, so you could even put this on right after today. The A+.
Yeah.
Yay. Oh, good. That's good to know.
Yeah.
It has over 450 growth factors in it.
Yeah.
And it's the
Third
only
pass
thing
on
on the
Okay.
market indicated for sagging skin. You'll see results with the A+ in as little as 2 weeks.
Yeah, just barely
so
feel it.
Okay.
we're really, really excited to bring that one in.
It feels so good. Not this. This doesn't feel bad. She's on the 3rd pass right now, and the 2nd pass I think was a little worse than the first, but this one I can really barely feel.
Okay.
But the TNSA Plus is what feels so good.
What's the difference between Secret RF and regular microneedling?
So Secret RF goes deeper, and we can actually customize the treatment to different depths in the layers of the skin. So with the RF, radio frequency, it's heat energy. So whenever I penetrate the skin with these needles, it's creating little thermal injuries under the skin and creating collagen production.
Perfect. And so microneedling, as she said, just doesn't go as deep, then obviously doesn't have the Secret RF or the radio frequency part with
and
it.
this is even comparing them to microneedling, it's much more high powered. The needle in this tip has 64 pins. A microneedling tip only has 12 pins. So a big difference in the amount of injuries that we're placing under the surface of the skin, but also adding the thermal energy with the radio frequency with it is huge for the difference in level of treatment that you're getting with Secret RF.
Right. So I think that, we love microneedling. There is no doubt about it. But Secret RF is just a much superior treatment but you're getting so much more out of it. But you really get great results with microneedling as well, and all the things that we talked about that our Secret RF can help with, the microneedling can as well. I personally like to do the PRP with the microneedling, and PRP is platelet-rich plasma, and that's going to help the healing time and help with increased amounts of collagen stimulation. So for these treatments are collagen stimulation treatments, so I feel like we should absolutely have these treatments as our baseline, and then you can do the other treatments that are going to be more superficial. So when I say baseline, this is going to go the deepest along with our Ultherapy. That's why we like the combination of the two, and it's going to stimulate the collagen to tighten up the skin. So the main purpose of the collagen stimulation, like this, tightening up the skin, and then you add some of the other treatments that we talked about, the laser genesis, the limelight, even our diamond glow. You know, diamond glow in 2 weeks would be an amazing thing. Those are the things that are going to give us surface changes a little bit faster. So we like to have combo treatments so that we can see results faster, but also have more long-term results as well.
Right. We're actually going to move up now
Okay.
to the lower face.
Okay.
So here we go. You just tell me.
Okay.
Here we go. You okay?
Yeah.
So I always make sure the patient's comfortable as much as possible, because we can, like I said, customize this so I can turn down the intensity of the needling.
And I definitely think the jawline is more intense, but it's still, this is maybe a 3 or 4, maybe, but probably a 3.
Okay,
It's not bad at all.
good.
And you got it as deep as we can go?
Yep.
Yay!
And the intensity
And the-
is pretty high,
Okay,
50%.
good.
So
Good. And that's
I'm gonna go on this side.
And that's the thing, is that it's not, like you said, you can, go cater to whatever we need to do. If you
Right.
can handle it deeper, we're going to go deeper and hotter. But if you can't, you're still going to get great results. But we may want to add on an extra treatment or something like that.
Right.
I mean, there's no doubt you can feel this. But it's not
tolerable.
that bad.
It's tolerable.
Yeah,
for sure.
and it's not as bad as Ultherapy. Ultherapy is definitely more intense, but it's so quick that you can tolerate it. It's not bad at all.
I'm gonna do your chin.
Okay, now it'll be a little bit worse, I think, on the forehead, maybe the upper lip.
But you can see the needles
The
there each
stamping.
time that she stamps and pulses. And just to kind of give you an idea, Steph grabbed the micro pin tip. You want to put that in view. So that's what a micro pin needle looks like.
Oh, good. So that's a great comparison.
Yeah.
And obviously, when you think about it, the microneedling isn't as intense, so it's not going to be as expensive as Secret RF. Not that Secret RF is terribly expensive, but I always say the less intense it is, the less the price is. So if you want to hit it hard and you want to do less treatments, you're going to spend a little bit more, but in the end, you're going to get better results.
Right.
So when we get to the fall and winter, doing Ultherapy and our pearl treatment is our best treatment, but you have a lot of downtime with that. So the secret is the next level down, you don't have as much downtime,
Right.
but you have to do 3 of them. So it all comes down to how many treatments you want to do. I personally don't like to do a million treatments, so I try to go as deep as I can. Get tortured as much as I can. The
In
least
one
amount,
setting.
yes.
If you go deep and then you're really diligent about your skincare at home,
Yes.
the skincare is gonna change things from the surface. So you do the deep treatments in office, and then your skincare is basically a treatment at home, not just product. So
gonna do
that
your left.
helps reduce the brown, improve the texture, decrease the pore size, all of those things that you see from the surface.
And just creating a healthy environment. I mean, that's really what we're trying to do. As we age, we lose our collagen stimulation. It breaks down even more. The environment, of course, wreaks havoc on our skin. So that's why the treatment at home, your products at home, are doing more than just moisturizing your skin. You are actually protecting and treating your skin and creating that healthy environment.
Someone just joined on Instagram Live asking what device we're using. We're using the Secret RF by Kutera.
And the other great thing about this one is that it's great for all skin tones and types
Yes,
too.
it is.
So even with the heat energy, we have different insulated needle tips to protect the epidermis, so the outer layer of the skin.
And it even, some of your tips are for like younger people or people who don't have as much damage, as much fine lines and wrinkles or even coarse lines. And so that's what it is, pretty neat, because you can pick and choose which settings, but you can pick and choose which tips you can put on it too.
Right, I'm gonna do your upper lip.
Okay,
Here we go.
this could be bad.
Right, so I was waiting. Okay, here we go.
Okay.
You okay?
Mm-hmm. It's not bad. Good.
Doing okay?
Oh yeah.
They're wanting to know how it feels.
So that I've been kind of saying between a 1 and a 10. That was a 1. I mean, I barely felt it, but I put extra topical on there. So everybody that's watching, we put topical on. I had topical on for about 45 minutes, which is why I'm having a hard time talking, because my lips are numb. I'd really like to get my lips injected today too. So if anybody wants on board, but it's not been bad. The jawline so far was the worst. The second pass has been a little more intense than the first pass, but that I didn't feel. So
Good.
are you doing a
Okay,
second
I'm
one?
gonna Yep.
Okay.
On your lip.
Okay.
Go. Start here.
So, in talking about treating the lip lines, some of the products that are good for improving those lines as well, we already talked about the advanced serum, but also HA5. And HA5 is a great product for post-treatment after Secret RF, microneedling, both of them. It will help you produce more of your own HA, and as we age, we produce less of it. And it's what holds in water. So we're holding in less water in those areas around the mouth and the eyes, and that's
Do your
what's causing us to
Okay.
wrinkle.
I'm gonna
So
turn you to the left.
that would be
Or the other way.
Dr.
Sorry.
Jacobs
Sorry.
uses HA5. She loves it, but definitely something we'll put on her today whenever we're done.
So that second pass over the lips was more like a 3. So it still didn't hurt that bad, but I could feel it a lot more.
And that one was more superficial.
Isn't that interesting?
Yes.
So I don't know if it's just because it's the second pass, like you just hitting it again as to why
Right.
it does it. I'm guessing that's what it is. But like this is very tolerable. And then, so you do 3 passes everywhere?
2 to 3.
We
2 to
try
3.
to do like the more, troubled areas.
So make sure,
Obviously.
these are my troubled areas through
Okay.
here, so let's make sure we can do
Yep.
like 20 passes
Okay.
on those. Just keep hitting it.
Here we go.
Is there much downtime with Secret RF?
No, that's the beauty of the Secret RF. And what we'll do is we'll take photos right after, and we'll take photos every day, or I guess tomorrow's already Thursday, but the rest of the week, and post them up, and you can see what my skin does. But I am super, super sensitive, and I usually get pretty red after treatments, and this one I'm back to normal in 48 hours, but looking really good even at 24 hours. And that's what we love about it, because there really isn't much downtime. And with the use of our color science products, you can actually cover it up tremendously, and you're putting healthy products. There's no chemicals, because we're very, very particular about what we can put on our skin after this. But you don't want to put your regular makeup on. You actually don't ever want to wear any regular makeup. You really want to wear color science products because of how healthy they are for your skin and what it's protecting. We call them EnviroScreen, so it's protecting you from the environment, and the sun, including blue light and infrared. And so that's really what you want to be putting on your skin, especially if you're going to spend the money on treatments. You want to make sure you're doing the right things for your skin. But after this is done, we typically want you to keep, don't put anything on for 24 hours except for the post-procedure products we gave. But let's say that I was a bad patient and I'm like, oh, I have an event tonight. I technically could put my Even Up on and it would be completely covered. It looks amazing, and again, it's helping to heal the skin a little bit, but we try not to have you touch anything. And then in this day and age too, I don't want you wearing masks right after this, so we really want to keep you at home so that you aren't out having to wear a mask anywhere.
I'm going to turn you.
Okay, and that's just for probably 24 to 48 hours, and that's just so we don't introduce any kind of bacteria. And now that, was that 2 or 1 on that one?
That was 2 on your
That
left
was
cheek.
2, okay.
This is the second one on the right.
So I can feel like a little bit of heat. It's not like burning, it's just it feels warm.
Okay.
Almost like I've been outside in 100-degree weather,
You're getting a good reaction.
Good.
What do you think, Jill?
Her reaction is perfect. It looks great. It's exactly what we wanted.
Yay. Now just tighten it up. Is this 2 or 1 on this one?
This is number 2.
2. Okay, good.
Yep.
Yeah, because I can always, like I said, the second round is a little bit more intense.
Right.
But
we're
still
gonna
not
move,
bad.
We're going to move up to the
Okay.
forehead, okay?
Okay. So I know the forehead's a little more uncomfortable.
The bony areas, like the forehead and the jawline, tend to be the most tender, but
Actually, I'm gonna turn you
patients
slightly
really do
to the
get
left. Yep.
right
Okay.
to this treatment, no problem.
Okay.
Here we go.
I think a lot of this is more the anxiety of not really knowing, what it's going to feel like. Yeah, and this isn't bad. I mean, it doesn't hurt. It almost, and I hate to say tickle, but it's just a weird sensation.
I think it feels like little hot pricks on the skin is what I felt like the forehead.
Yeah.
feels like.
And then, like in the center of the forehead, I could barely feel it. Kind of feel it a little bit more on the outside here.
Like on the temple
On the
area?
temple, yeah. Yeah, barely through there.
Good.
That one hurt.
Sorry.
That's all right. That was more in the hairline.
Sorry. I know. I want to get all the little areas.
Yeah, so this, I'd say that's the most uncomfortable so far. Still 3 to 4. Not that bad. And I feel like we're doing surgery with that beeping sound.
I know. You're on a monitor.
Yeah.
People always say with microneedling, they feel like it sounds like they're at the dentist. because
Yeah.
Oh yeah, the vibration.
Yeah. Ooh, see, I could definitely feel this, and then I'm getting the little, what do you call those? The nerve?
Like the tingling or?
Yeah. What do they call those, Jill? Where we do it with therapy, and you get a little nerve.
It's just some
uh,
stimulation
yeah.
of the nerve, and sometimes
Yeah.
you can feel like somebody's like tugging your ponytail on the back of your head.
And that's
just
what-
when we hit a nerve
Yeah,
on the
a
forehead.
couple of those felt like that.
Okay.
It just feels weird.
So we're going more shallow or more superficial.
Okay.
Here we go.
But for some reason, these always. That's not too bad. Yeah, I would definitely say the forehead is the most intense. But still, not as bad.
Doing okay?
Yeah.
Okay.
Yeah, nice deep
Gonna
breaths
turn you.
sometimes, helps, but as I said, I'm a baby, so I don't love pain. And there's really not much besides a topical we can do, for the pain. And it's actually, I shouldn't even say pain, for it's uncomfortable. And we did do, Jill, didn't we do some Secret RF on an abdomen?
Yes, for tightening. So that's another thing that we could treat is skin tightening. We did a lower abdomen. Another area that would be great for is
Do your
arms.
I'm sorry, what?
Do your eyes.
Okay.
To
This one's a little
improve
bit more
the
deeper
tone
than the
and
last.
texture and tighten the arms or above the kneecaps, anywhere where tightening is needed. It's also good for scars. I had mentioned acne scarring, but also body scars would be a really great treatment as well.
Do you know how long you have to wait after a scar?
I think it's at least 6 months.
6 months minimum? Yeah. I was thinking it was a year, but then I thought,
I know for C-section scars they do say a full year.
yeah.
Because the body changes so much in that first year anyway for C-section scars.
Yeah.
Bless you. So I'm just pulling the skin a little bit taut when I go around the eyes, because we always want to make sure we're right there on that orbital rim bone.
Oof.
You okay?
Yep.
Ready for
Still
the...
only a 5.
Okay.
I mean, it's still, that was definitely the most, or going around the eyes was definitely the most intense, but still probably 5 is being baby, but, because now it's gone. Like I don't feel anything except for that
Okay.
little bit of burning sensation, but.
You ready for the nose?
No.
Okay.
Okay.
Here.
I'm ready.
Okay, and I can turn it down too. So,
Okay, well, let's see how we do.
Okay, here we go.
Not bad.
Okay.
Oof.
Sorry. Go right here.
Good?
Good?
Yeah?
I'm gonna go turn it down.
Okay. Oh, I wonder if I got topical in my eyes.
You need a gauze
Yes,
pad.
please. Try to open my eyes. And we can go over a little bit too.
A little bit.
Yeah.
Here you go.
Thank you, ma'am. I had my eyes closed this whole time, so got a little topical. I'll just keep them closed and it won't bother them. Okay. Where are we
Good.
doing next? How
I'm
much?
gonna do the nose. I'm just going a little bit shallow.
Okay. How much more do you have?
We're on, let's see, 700.
Okay.
A little over 700. So
Okay.
here we go.
Oof.
We'll go right here.
Okay.
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 Let me go.
Someone else just joined and asked what procedure we're doing. We're doing secret RF.
So it's a deeper microneedling with radio frequency.
Yes.
And that is to help stimulate collagen, help with fine lines and wrinkles, help pore size, discoloration, texture of the skin.
And
Okay.
I can treat stretch marks too.
Stretch marks, yeah.
Okay, I'm gonna go around the eyes one more time.
Okay.
Here we go.
That's not bad.
Okay. Just gonna go a little lower. You okay?
Yep.
You want to go
Good.
to 40%?
We can. Do you want me to turn down the intensity?
It's not
You
bothering
been-
me.
Are you sure?
Yeah.
Okay.
If you're doing it, keep going.
Yeah,
Right.
no, it's fine. That one wasn't as bad as the first round.
Okay. Here we go.
Okay.
Then we'll go around the mouth again.
Okay. Yeah, that wasn't.
I'm gonna go right under. Yeah, she's been keeping
that wasn't
strong
bad.
with the intensity, so
Yeah.
that's good. All right, we'll do the mouth.
Okay. And if you want stuff, I can set up. We can show what I look like, or we can keep going. unfilmed. So whatever you want to do.
Yeah, you're looking pretty red.
Okay. So as soon as she's done with this part,
Do your top lip.
yeah, go ahead, and
Okay.
then I'll lean up
Yeah.
so they can see. Ooh, yeah, got me.
You okay?
Yep.
Here we go.
Okay.
Yeah.
Okay. So this is what I look like. I don't even know. Do I look like a monster?
You look good.
So
The redness
bit
is
of red.
exactly what
That's what we want.
Not
Okay.
terribly red, but you want red, and it's exactly what we expect. We want that deep redness. By tonight, even it'll probably be like 50% gone.
Gosh.
And by tomorrow morning, she'll only have just be a little bit pink, and you can tell them what product she'll use tomorrow morning to cover your redness. And
yeah, tomorrow. Let's see. Tomorrow I'm in clinic, so I probably won't put any. I'll probably just do my TNSA Plus, my Lumi Vive, and a moisturizer. I probably won't even put any of the Even Up on because I like to show the
Right.
redness in the clinic. Plus, we're going to have our masks on. But I like to show what it looks like and say, hey, look what I had yesterday, and this is how good, hopefully, my skin looks. As I said earlier, I have super sensitive skin, so sometimes mine is red a little bit longer than the normal person. But the last, I think we've done we might have even done 3 of these last year. I didn't have redness more than 24 hours. So just to summarize, this is the Secret RF, which is deeper microneedling than a typical microneedling. And it has radio frequency, which is heat energy. So it's going to help with fine lines and wrinkles, tightening up the skin, pore size, texture of the skin, color of the skin. So really, it's just creating a healthy environment, and your skin will just look so much better. It helps treat your face, your neck. You can do your chest. You actually can do your arms, your legs, really any part, abdomen, really any part of your body to help tighten up that skin. We recommend doing a series of 3, 1 month apart. We love to combine this with our Ultherapy because Ultherapy uses heat energy as well, but it's a little different and it goes deeper. So the Secret microneedling portion goes deeper than regular microneedling. The radio frequency or the Ultherapy's heat energy goes a little deeper than this radio frequency. So it really is a great combo because you're going to hit every layer of the skin and hit everything that you possibly can do without having surgery. So it's a really great procedure. You want to do this before you do fillers or before you do Botox is fine. You can do it at the same time, but you want to do this before you do filler because you want to tighten up the skin as much as you can. Then that filler is going to come in and lift even more. So you can do this in combination with a lot of different things, but we truly will stick with Ultherapy, even Thermi. You could do Thermi around the eyes if we wanted to, and this as the skin tightening treatments. So if you have any questions, if you want to come in and talk about it, please give us a call. Our number is 618-288-9117. Thank you so much for watching.
Thank you.